People with urgent health problems are feeling reluctant about going to the hospital with a hyper-focus on people suffering from COVID-19 and reports that hospitals are getting overwhelmed. Mercy General Hospital COO Devan Johnson joins us now to share why we should never doubt our health. Welcome to the show.
Welcome. Thanks for having me.
So are people really refraining from hospital visits because of the coronavirus pandemic?
Yeah, we're definitely seeing a decrease, particularly in the emergency department, and we're seeing a decrease in emergency 911 calls, which has us concerned.
So talk about this. When they're refraining from going to the hospital for medical emergencies, doesn't this really create bigger problems down the road?
Yeah, so when we think about particularly with things like with heart disease or chest pain or stroke, we talk about time being tissue. And so if you're delaying it because you think you might be afraid to come to the hospital, you actually could be putting yourself at greater risk and having more severe complications or even worse outcomes, like putting off urgent or emergent care.
And I think a lot of people, they are fearful of going to the ER or hospital because they don't want to get COVID-19. They think, oh, if I go to the hospital, I'm going to catch it somehow. And they're also not sure if their emergency would be considered a top priority right now. Can you tell us maybe about a few medical emergencies that people should definitely not hesitate to go into the hospital for?
Yeah, absolutely. And the ones that we're really talking about today, I brought up already. The big ones are stroke and heart attack. If you are stroke and heart attack, if you're feeling those symptoms, signs and symptoms, you should definitely call 911 and be seen and let a provider evaluate you. And I would tell you, I understand that fear. I think it's out in the community about COVID. The hospitals have done a lot. Our job, our role is to provide safe care to our patients, to protect our staff, to protect those who visit the hospital. And we've spent a lot of time, energy, and effort to create those practices, to buy the PPE. We provide safe care for our patients. And so if you come to the hospital, you're not any more likely to contract COVID at the hospital than you are walking around the community. And it's probably even more protected here because we have the safeguards in place to protect you.
And I think that's good. I think people need to hear that from someone like you. They need to know that they can still go in if they need to. Now, when we talk about the numbers, have 911 calls, those emergency calls for heart attacks and strokes, have you seen a decrease since the pandemic began?
Absolutely. So we're starting to see, and the data is sort of reflecting that 911 calls are down by as much as 26%. Chest pain calls specific to chest pain, which might be heart attack, are down by as much as 31%, and stroke calls are down by as much as 20%. And the incidences of those aren't down. There's no reason to think that there's less heart attack or stroke in the community than there was prior to COVID. What's happening is people are putting off the call for things you said. They're not going because they're worried that maybe it's not going to be an emergency. And if you're having those concerns, you really should have a qualified provider at the ER assess you and help you get through that process and get yourself taken care of.
Yeah, I think you make an important point. Just because the calls are down doesn't mean that these things aren't happening. So when we talk about these things, what are the signs, what are the symptoms that folks should look out for if they think that they're experiencing a heart attack?
Oh, this is great. So the American Heart Association has actually put out in their Don't Die of Doubt campaign what these signs and symptoms are. For heart attack, they have it out there. If you have chest discomfort, or if discomfort in other areas of your upper body, or shortness of breath. Other ones could be cold sweat, nausea, lightheadedness. For women, it might be chest pain. It could also be shortness of breath, nausea, vomiting, back or jaw pain. For stroke, I think many people have heard what's called FAST, F-A-S-T, so face drooping, arm weakness, speech difficulty. And then if those things are happening, it's time to call 911. So those are the signs and symptoms, and you can find them on American Heart Association website and part of this campaign that they're out there trying to educate the public about.
That's good to know. It's good to know what to look out for, and it's good to know that it's not the time to put it on the back burner. If you're experiencing those things, don't mess with your health, right? Don't take a chance. You've got to, if you're experiencing something serious like that, call 911, go into the emergency. You guys are going to take care of them, right?
Absolutely. Absolutely. That's what we're here for.
All right. Devan Johnson, thanks so much for joining us this morning. And for more information, you can go to heart.org.